Hi, this is Brian Kim. I'm going to share with you episode number 1 in the surgical instrument review series. And this is the Bakewell Haldipurkar capsulorhexis forceps made by Epsilon, item number ERF-31. And this is the first day I'm using these forceps, and I want to tell you these are an absolute game changer. Actually, this is an interesting story. This fellow surgeon, Dr. J.R. Singh, he's also a subscriber to my channel, and he wanted to come and visit me in surgery and watch me do cases. And he told me about his interest in surgical instruments. And he recommended these forceps, and I had no idea about them. And so I tried them, and I was really blown away. And so think about the standard capsulorhexis forceps, the Utrata style forceps, and they coapt and come together like a standard forceps. And the ideal forceps are they come together and they grab the capsule. You're able to puncture with them. They cause minimum oar locking as well as viscoelastic egress as you manipulate those forceps. And so look, I'm going to use an example of some tongs. So see some kitchen tongs, and you can see they come together, and this is very similar to the standard Utrata style forceps. They come together and the teeth meet together. But the limitation of this is the action of the forceps is behind my hand. The hinge is behind my hand. And you can also see that there's a fairly thick profile to those tongs. And so that's what I'm trying to show you here. The profile is rather thick, i.e. the height of the instrument is a little bit more than you'd like. And if you have a vertical height to the instrument, it's going to cause more gaping of the wound. So let's compare this with some scissors. So this is just some standard kitchen scissors, and you can see the hinge of the action is in the middle. And so this is similar to the cross-action style capsulorhexis forceps we have, but more importantly, look at the scissor design. The blades come together and they are on top of one another. And as a result, you can see this rather thinner profile to the scissors. And because of that thinner profile, it allows a decreased vertical height dimension to the instrument. And so again, the tongs have more of a vertical dimension to the instrument compared to the scissors, and the hinge is behind my hand, whereas the hinge here is in front with the scissors. And so these are the forceps. Look, you can see they're cross action. So the hinge is in front of me. And look at the blade. The blade is like a scissor design. Very thin vertical height aspect to the forceps. And these ones are blue. They're made of titanium. But you can see as the teeth come together, at least on the back side, they are on top of one another. Of course, towards the tip, they're side by side. So it's a very interesting design. I've never seen forceps like this before. I'm able to puncture the center, and with the teeth closed, I kind of grab and push to the right. And I'm able to grab the edge of the tear, and then very carefully and controllably, I'm able to do the rhexis here. And it's able to open quite widely inside the eye with very little restriction. I'm just removing this air bubble here. So you can see I'm able to open them quite well without much difficulty. I have limited viscoelastic egress as I'm doing the capsulorhexis. I'm able to have very fine control, and the forceps coapt quite nicely, and I'm able to grab the capsule fairly easily here. And so this is the end of that case, and you can see the rhexis is nice and round with 360 degrees of overlap. I didn't struggle doing the rhexis. Again, this is the very first time I'm using these forceps. Now these are not cutting tips, but I'm able to still puncture with these forceps. I puncture, I pull down towards me, I grab the right side of the tear, and again, I'm following the marks that I made previously to help me guide the size and centration of the rhexis. You can see I have just really exquisite control. I'm able to open the forceps nice and widely without any difficulty. Now, one thing I noticed here, again, this is like the second case. As I'm moving here, I can feel a little bit of a ridge there. And so I was going back and forth, just trying to simulate the catching of the forceps there. So again, that was my second case. Interestingly enough, I did not experience that feeling once I got used to the forceps. And I suspect it was because I was pushing down a little bit while I was doing the rhexis, and that's what I felt with the snag. But as I started getting used to the instrument, I didn't have that experience. And I take it it's because I didn't push down so much and get that feeling of the resistance from the bottom edge of that forceps. So again, you can see how nice and well-centered and sized the rhexis is with 360 degrees overlap. This is the third case. Fill the eye with some more viscoelastic, and I try to put that little dollop of viscoelastic to simulate about the size of the rhexis. Again, I'm just showing again the forceps. There's a little hash there. I don't know if you see that. That hash is supposed to help designate your size of your rhexis. I don't really use that since I use the corneal marker, but that's another nice feature that they have on this forceps. So again, I do a puncture. You can use that little hash to measure your rhexis size. So I'm going around as I normally do. But again, I have really nice control. I'm not having to pull inward. With the old Utrata style forceps, I was always having to pull inward just slightly, just to control the forces and to get that nice centered and sized rhexis. Unfortunately, when you're having to deal with those forces that are causing the rhexis to go out, you can't always get a perfectly sized and centered rhexis. And so with this, I've noticed that I don't have as much fluid egress. I don't have to pull inward while I'm doing the rhexis, which just again is a testament to the fact that there's very good chamber control, very, very good control of the forceps, and I don't have to pull inward. Therefore, I'm able to precisely make my rhexis the way I want to. And so you can see again, this is the end of this case. Again, 360 degrees overlap, a perfectly sized and centered rhexis. And again, these are all cases that I did on the same day, on this very first day using these forceps. And this is the next case. I filled the eye with some more viscoelastic and I'm going in with the capsulorhexis forceps. I'm going to puncture the center, pulling down towards me. With the teeth closed, I kind of nudge it to the right, grab the right side of the tear to create a flap. I'm able to go around circumferentially. This patient has a little bit of eye movement that I'm watching very closely. I'm able to grab, and again, I don't have to pull inward, which is really nice. It just kind of emphasizes the chamber control that I have, so I don't have to be worried about the rhexis radializing. And this is at the end of the case. You can see there's again a nice, well-centered and sized rhexis. I haven't had any trouble with this capsulorhexis forceps so far. Now this is a dense cataract with trypan blue, and because I'm new to these forceps, I went ahead and used the cystotome because I didn't want to experiment in this situation. So go ahead and use the cystotome in this case. So grab the flap, going around circumferentially again. Again, I have really excellent control with these forceps. It's not radializing. This is not an intumescent white cataract, so it's quite a different scenario. And of course, as I use the forceps more and more, I'll be able to determine the advantages and the limitations under different situations. But again, so far, very good control. The rhexis doesn't want to radialize. I don't have to be pulling inward the whole time, in contrast with the other forceps that I had. The teeth come together real nicely, and the teeth open up very, very widely. And so that's the other thing. With the other Utrata style forceps, sometimes the forceps teeth at the tip don't open wide enough, and you're having to try to grab, but there's a really nice wide opening of the teeth. I'm also able to bring the teeth together, and there's a very nice grabbing platform. It's not slipping at all as I'm doing the rhexis. And so this is the next case. Again, I push some viscoelastic in. Puncture the center. And again, these are not sharp-tipped forceps, so that's the kind of the only other criticism I do have. I'd like to have a sharper tip so I can puncture the capsule easier. You can see I have great visualization. I have really great control. I'm able to go around. Again, minimal viscoelastic egress, again, because of the scissor style design. Minimal gaping of the wound, minimal viscoelastic egress. Because it's cross action, the hinge is right at the wound, so it doesn't cause any gaping and minimal oar locking as I'm doing the maneuver. So again, this is the end of the case. So again, you can see 360 degrees overlap of the rhexis and a good size and good centration. This is the next case. Go ahead and puncture the center, pull downward, teasing the tear towards the right to create a little bit of a flap, grabbing the right side. I have very good control. Another thing I've noticed, and it's not really obvious here, but with the other forceps, it would be difficult to grab the capsule sub-incisionally. And so when I'm near the wound and I'm trying to grab the flap, it would cause corneal stria and it would be kind of difficult. I'd have to maneuver the forceps. With these, I didn't have that issue whatsoever. And so, oftentimes when you're trying to do the rhexis and it's near your incision, you're kind of taught to just go ahead and don't re-grab, just finish it because you might lose it and you might not be able to grab it again. So in this case, the pupil is a little bit small, so you can't really appreciate the size of the rhexis here. But again, I'm just showing you all the cases I did throughout that day. So this is a nice big pupil. Puncture the center, pull down, sweeping a little bit to the right. I just have very nice control. I'm able to manipulate the tear and control the size of the rhexis really well here. You can see how big the teeth open up. It's just, again, very different from the forceps that I had before. The teeth just didn't open up as wide. And so when that happens, it just gives you a lot more confidence and it's just easier to do the rhexis. This is the end of the case. You can see there's 360 degrees of overlap again and a well-centered and sized rhexis. So again, this is my first day using the Bakewell Haldipurkar capsulorhexis forceps made by Epsilon. I was using the standard Utrata style forceps before, which is analogous to like using a tongs. But again, the hinge is behind me, and therefore when you're trying to open the teeth, you're going to get more oar locking at the wound. Also with that kind of design, you have to have more of a vertical component to the forceps because of the design. This is very different. The design is a scissor style forceps. And so the scissor means that the hinge is actually in the middle. So again, it's that cross action concept, but also because the blades are going side to side on top of each other, there's a thinner vertical profile to the forceps. And as a result, less oar locking, as well as less viscoelastic egress in theory, but also just my experience was such as well. I didn't have as much trouble grabbing the rhexis edge. I was able to open the forceps much better than I was before with the Utrata style forceps. I didn't have as much oar locking, less viscoelastic egress, and as a result with the technique before, I had to constantly pull inward depending upon the type of case I had because certain patients have shallower chambers and more of a propensity to radialize. I had to constantly pull inward to get a nice centered and sized rhexis. But with these forceps, at least on this first day and first impression, I had exquisite control, minimal oar locking. I'm able to see the rhexis edge and grab it even around the wound, which is again prone to difficulty because of the corneal stria and just the anatomy of trying to get underneath the incision. And I didn't really have any of those issues whatsoever. And so I'm really looking forward to continuing to use these forceps. And I do think, compared to at least what I was using before, This is an absolute game changer. And I had to go back and get this footage because I forgot to show you the entire instrument. And so in order for this to be a thorough review, I really need to show you the entire instrument, not just the front end of the forceps, but also the entire length of the forceps. You can see it has a rounded and textured handle, and it's made by Epsilon. Item number ERF-31. And that textured and rounded handle is something that I really like. That's just my own personal preference. I feel like I'm able to have more control, and I can rotate the forceps in my fingers, be able to access and grab the capsule a little bit easier depending upon the situation. Again, this is the Epsilon Bakewell Haldipurkar capsulorhexis forceps ERF-31. It's a cross-section forceps that can go through a very small incision. Actually, the instructions say you can actually do the rhexis through a 1.5 millimeter incision. I have yet to try that, but in a future video, I might actually try to do that. So through a 1.5 millimeter paracentesis incision, you can actually do the rhexis with these forceps. So this is episode number 1 in the surgical instrument review series. I'm really excited about the opportunity to start this series. So I've learned by using these forceps that I really need to open my eyes to a wide range of potential instruments out there. And so by trying out these instruments, I'm be able to expose you all to these instruments as well. And I'm able to show you the pros and cons of all these instruments. And I'll be continuing this series and showing a sampling of a variety of instruments for a variety of surgical steps in cataract surgery. And I really do hope that this series is going to be helpful to you. I know it's been helpful to me to open my eyes and my mind to the potential of all the different surgical instruments out there. And so I hope this video was helpful to you, and I thank you for your attention.